Well, look, welcome everybody. Our Ukrainian colleagues are on today, and sort of really our hearts go out. And we're here to help. Really, I think the radiotherapy community is uniquely placed. Obviously, we're a specialised, multidisciplinary group, but I think we're very good at joining together in community to actually find the issues around the world. So I think if you perhaps, I won't go around introducing it, there's so many of us, there's 75 registered to the meeting today, but please use the chat box, please introduce yourself so we know who's on, who you comment. People might want to look any comments in there if I don't get round to actually bringing everything in orally, or if people don't feel comfortable with the language. But we really appreciate everybody's input. We've only got this far because we've had so much input, which is great. So Preston, perhaps if I could have the first slide to show us today. It's quite full because there's a lot to get through, and I hopefully for discussion as well. We've reached out to much of the community, and now also to disease-specific groups as well as patient groups, so that hopefully we could be a source of the radiotherapy information that others can use and feed into, and hopefully by that way be efficient. We're really pleased to hear from everybody. There's lots of frontline workers here on the ground, as well as people who can help us make decisions. And we're specifically interested in how we can help individual patient requests, because they're coming through as well now. So without more to do, I want to hand over to Darien, who's going to present to you, since our last meeting, which was so helpful, we've created a needs document, we've populated the site. So I want to show you how far we've got, and then the next phase as well. So Darien, over to you.
Thank you so much, Pat. I'm going to go ahead and share with you my screen and keep my presentation as brief as possible. I echo Pat. We are so grateful for everyone attending and participating in this Radiotherapy Task Force. You can see here our homepage, and this is where we are sharing all of the resources that you've shared with us. Of course, we are updating the WHO through Professor Richard Sullivan. You'll hear from him shortly after myself, but we want to make all this information accessible to the entire radiotherapy community. So from our homepage, you can easily access this information from the banner off of the top with Ukraine. Also under resources, you can go directly to that page. I want to highlight on that page, we have a lot of information there that you can access, as well as a call to additional information. If people are interested in sharing more information with us, you can do that through our admin email, as well as my personal email, dlaird@globalradiotherapy.org, which we'll be sharing in the chat. And then as well, we have a wonderful link to the Ukrainian Association of Medical Physicists. We'll be hearing from the president, Dr. Ruslan Zelinsky, briefly in a moment. But even just going to this link, there's a lot of access to information in terms of hospitals that are up and running, access to contact information, capacity as well. This is kind of the key information that I want to make sure that I share with you today, the downloads that are at the bottom of this page. The Radiotherapy Task Force Ukraine Needs Assessment document is a complete document of all of the information that we have been collecting from all of you, that we've been using to update the WHO, as well as the ASCO Special Network. And this document is available for download. We'll make sure that we update it regularly. This was just updated yesterday after the WHO meeting that we attended with the new information in terms of numbers that they released. It has information about the methodology of the Radiotherapy Task Force, information from our first meeting, that slide for many of you who attended. These are the updated numbers from the WHO. There's tables in here with needs, with solutions for medium and long term, as well as links to Excel spreadsheets that we are constantly updating every 2 weeks, every week when we are reaching out to the hospitals in Ukraine and in the neighboring countries. Of course, we're working with our stakeholders, the industry, so Darien, Electa, Accuray have been updating the capacity for their machines as well, and the supplies that they're donating or the needs that those hospitals have. So continue to come back to this for more information. It will be continually updated, and we'll share that with the community. Also on the downloads, you can see this WHO Ukraine Cancer Emergency Response. So this was the download that I emailed to the entire Radiotherapy Task Force. They specifically mentioned the Radiotherapy Task Force community and thanked them for your contributions. And then finally, this download, the patient consent form, which Michael Milton from Darien will be talking about today. The consent form can be accessible here, as well as the instructions that he'll detail. And for related resources, We have several of our partners here listed and links to their Ukraine pages on their websites. If you're not listed here but you want to be included, we would love to have your logo and a link to your website so that we can really create this web page as a main resource for all of the radiotherapy community to come together and share what's going on, what you're doing with your individual organizations, and then people can take that opportunity to learn from one another and really make this a collaborative effort so we're most efficiently helping Ukraine patients, our colleagues, as well as their families that are being evacuated. All right, thank you. I'll turn it over to Richard.
Good. Well, thank you very much indeed. Just to say a few words, I'm going to be very rapid if you bear with me. Just briefly standing back, the security situation, of course, is increasingly kinetic with a new assault underway in Donbass. The major issues as well we're seeing at the moment is long-range bombing and cruise missile strikes increasing, particularly in the West, targeting rail infrastructure, but also hitting main supply routes, which also tend to be roads as well. What this means with the threats of air attacks, mines, unexploded ordnance, there are a lot of routes, particularly in the center and the east, are still not secure. So patients obviously finding it very difficult to constantly access centers, even if they are working. The estimates from the military at the moment is this is only going to increase as air assaults are brought forward by the Russian forces. The IOM UN migration now has an estimate of around 7.7 million internally displaced Ukrainian citizens, mainly from Kharkiv, the Kiev region, Luhansk, sorry. But bear in mind, there's still 12 to 13 million Ukrainian citizens still in the major conflict zones. Understandably, a lot of the focus, and I've been just in Dnipro, is on basic healthcare, also on security, trauma care, mass casualty training. So cancer obviously has to take its priority with all these other competing issues. UNHCR has about 5.3 million refugees now. Flows have slowed down, but there are some very, very complicated therapeutic geographies. We're seeing cancer patients starting in one country and moving to another country. We're seeing cancer patients go to one center and then moving to another center. And we even have cancer patients coming out of Ukraine, getting a diagnosis and then going back into Ukraine. Countries like Romania, for example, Moldova and Hungary, only about 25% of the refugees are staying there. They're moving on after that. Whereas someone like Poland, a lot are settling there. So the estimates are around 60 to 7% of the refugees in Poland are actually staying there. The disaggregated data from the Interagency Standing Committee, about 50% of refugees overall are women and only 14% are men, mostly elderly of non-fighting age. So fighting age men between 18 and 65 are staying inside Ukraine. Very few healthcare workers at the moment have moved out of Ukraine, so they haven't seen any brain drain as we saw in other conflicts around the world. As Pat said, we've at WHO had two surveys now, one a facility level survey and a cancer center survey, which were presented yesterday. The Ukrainian data on the capacity and capability is pretty good, and the majority of patients for cancer are staying still within Ukraine. And there's absolutely no doubt about that looking at the numbers. There are certain areas for which Ukraine is struggling, and I'll give you an example: bone marrow transplantation. But generally speaking, each of the centers are coming up with at least one or two domains for which there is capacity and capability issues. The Ukrainian Ministry of Justice has put together a referral list, which I'm not sure is in the public domain yet, so I can't really talk about it. But nevertheless, most of the referrals are either self-referrals or they're being managed by patient organizations. And I'll say a little bit more about that in a moment. But the picture is, as I said, very dynamic and complex. The Cancer Center survey, Extra Ukraine, which focused on Moldova, Romania, Hungary, and the Czech Republic. To be blunt with you, the numerator is not sufficient to say much about what's going on. We only picked up about 450 patients or so. And just bear in mind here, of course, these are just the neighboring countries. We're aware a lot of patients now are moving on to third countries beyond the immediate neighbors. So, for example, from Moldova to Austria, the Ukrainian cancer patients moving into other countries. And also to say childhood cancers are being managed entirely separately through the St. Jude's WHO networks. I'm not really talking about them at all. I'm just referring here to adults. So there's a bit more work to be done to understand really what's going on in the neighboring countries. I think the issue for the WHO at the moment, first, it's been negotiating on the essential medicines. This is a very complicated process filled with bureaucracy at the highest levels. They're very close to getting a deal now. That has to be funded, but that really is WHO, UN to the Ukrainian Ministry of Health. Below that, most of the oblasts, most of the cancer centers are working with patient organizations and other humanitarian agencies to source their own medicines right now. So where there are stockouts occurring, people are finding whatever method or whatever route there is to access the stockouts for medicines. I'm not going to say anything more about radiotherapy. It's wonderful that you're doing this work, because I think radiotherapy was sort of missed out in the initial tranche. At the moment, we're not having many issues in surgical oncology, but there is expectation as things worsen potentially that there will be major issues in surgical oncology. The other thing to finally say for the WHO is the focus has been on Moldova in the last 3 weeks. And the reason for that is Moldova is already wildly over capacity. As a country, they had enormous difficulty servicing their domestic needs even prior to the conflict. And there'd been a mission already to look at the capacity and capability needs in Moldova. I will say as well, there's probably issues in other countries, significant issues in other countries, but because Moldova was considered to be so fragile, the focus really was finding a support package for them right now, and also finding ways to triage patients to other countries. And finally, to say the majority of patients that are being managed and triaged at the moment are coming through the work of some outstanding patient organizations like the Lymphoma Coalition, working with hemato-oncology patients who've been moving patients from country to country, and also twinning doctors in individual centers. And really, they've been doing the bulk of the heavy lifting. There are formal transfer protocols now in place through the EU and WHO, but our estimates are that probably represents less than 10 to 15% of the true patient movements outside Ukraine. And Pat, I will stop there and hand back to you. Thanks very much.
Excuse me. Well, first of all, let me personally, and I think maybe on behalf of both of us, thank you for the possibility to contribute to the fulfillment of the noble task set by the coalition. Ruslan and me, we have made research both based on the open data, based on the open data, and interviews with the oncology centers about the capability. Have prepared a presentation which will give you a short view of what were the developments in the radiotherapy sector in Ukraine prior to the war, which actually started in 2014, which were developments during these 8 years before the full-scale invasion of Russia in February of this year, and the current situation, So Ruslan will start.
Okay, I see my screen. Okay. Thank you for the introduction. First of all, I want to say thank you for your support. We feel that we are not alone. And for your full understanding, I want to describe the state of radiation therapy in Ukraine before the war, and mention some trends in recent years. I want to start from 2014. From January. This is a map of our country. I think you see it. I marked all the centers which provide external beam radiotherapy service. The blue mark is linear accelerator, and the red mark is cobalt-60 machines. In total, 42 radiotherapy centers, 20 linear accelerated, and 86 cobalt-60 machines. What's the main problem we had? Of course, first of all, it is a low number of linear accelerator. Only 20 machines, that is only 19%, and most of them is in the center of Ukraine, in our capital, in Kyiv. Also, uneven distribution of equipment by region. For example, we had two large number of machines in two regions, in the center in Kyiv and in the east in Donetsk and Lugansk region. We have here 22 machines for external beam radiotherapy. Also, as in any country that it just beginning the transition from old COBOL machine to modern Linux, we had problems with insufficient level of development of medical physics. But despite the problems, despite all the problems, I remember we had a lot of plans. For example, it was planned to build a first in Ukraine proton center in Donetsk in the east. And of course, placement Cobalt 60 machines to Linux. But unfortunately, the plans were not implemented because in 2014, Russia, with the support of local separatists, annexed one region in the south here, and parts of two regions in the east, included one of the major regions of radiotherapy with very big numbers of machines. In 2014, Ukraine lost the control of 10 radiotherapy centers, 3 linear accelerators, and 15 Cobalt machines. But despite the long-running war in the East, the field of radiotherapy in Ukraine has developed. During 8 years, from 2014 to 2021, 16 linear accelerators were installed, and 5 new were under installation in the end of 2021. Also, Ministry of Health of Ukraine initiated the purchase of another 2025 linear accelerator during next years, 2022, 2023. Also, during this period of time, the Ukrainian Association of Medical Physicists was established, which began to develop education requirements for medical physicists, training courses for medical physicists, and in 2021 we become a member of the European Federation of Organizations for Medical Physics, and of course we'll have a lot of plans. As you see, again, a lot of plans and moves towards the development of radiotherapy, but as you know, on February 24, Russia is starting a full-scale war. This had a catastrophic impact on radiation therapy, especially in the first weeks, because most oncology centers have a suspended radiotherapy service. After 3 weeks, approximately in mid-March, the Russian army was stopped by Ukrainian army, and the map of occupied territories was, you can see on this picture. Almost all radiotherapy centers in and around Kyiv, in the north and east part didn't work. 2 radiotherapy centers in south, just Kherson and Melitopol, was completely occupied, but we continue to treat patients who remains there. Radiotherapy centers in the center of Ukraine and in the west of Ukraine resumed their work. Over the next months, from mid-March to mid-April, Ukrainian army liberated the area near Kyiv and also in the northeast part of Ukraine. And occupied territory looks like this picture. This allowed many oncology hospitals to resume radiotherapy service, especially in Kyiv, where we have 20 Linux, where 20 Linux are located. This is about half of the total number of Linux in Ukraine now. And at this point, Alexander will continue and tell in more details about current situation and needs of radiotherapy centers. Thank you for your attention, Alexander. You can continue.
Yes, thank you, Ruslan. First of all, I'd like to remind that what I said before, that the information which I will share at the moment, which I will share now, is based both on open sources and on direct communications with head of radiotherapy centers. I didn't have a possibility to speak to all of them, but step by step, we will have a 100% picture of what is going on, because in the territories which are under hostilities or occupied. The doctors are not always willing to communicate, but step by step we'll have the 100% picture. There is a table which I think you have access to, which has the details of each regional oncology center with all the list of equipment, with contact details, and with the needs. But let me give you the general picture. So at the moment, with the exclusions and exceptions provided below, all regional oncology centers and radiotherapy centers are functioning normally across Ukraine. Exclusions are Kharkiv. The city was and still is a target of a massive attack. A big part of the population has left the city. This was the second largest city in Ukraine in terms of population. And of course, a lot of people has left because about 20-25% of all buildings in the city were damaged or destroyed. And in the hospitals, doctors and patients live there, and the doctors try to treat their main patients, but situation there is very difficult. Chernihiv center was damaged, but later it appeared, the information appeared that it resumed its operation, but some equipment was damaged. The city of Kramatorsk is under permanent attack, and 10 minutes ago there was information there was another air assault on the city, and we may assume that this center is working with problems. According to the information which was received by Ruslan, the hospitals in the occupied cities of Melitopol and Kherson, this Kherson region in the south, are under are functioning despite of the occupation. And the worst situation in the city of Mariupol, which was almost level to the ground, including the hospitals. So it's 99% nothing is working and was destroyed, and the destiny of the Cobalt device is unknown. As for the equipment, the detailed information you will find in the Excel table, which is accessible to you. But the general tendency is that the majority of hospitals largely use the outdated equipment, which includes different types of agat for gamma therapy, Cobalt devices, various types of agat for brachytherapy, and various types of Arium for X-ray therapy. Several hospitals have relatively modern linear accelerators. This is the capital city of Kiev, the large cities of Lviv, Zaporizhzhia, Dnipro, Uzhgorod, etc. According to the information received from the doctors directly, the majority of the equipment is functioning normally. In some hospitals, there are problems. This information you may also find in the table. And in some cities, the doctors informed that there are problems with equipment which is reaching the limit of its life or has some technical issues. But generally, the equipment is operating. As Ruslan said earlier, only a few doctors have left the country, so the majority of specialists are in place and assisting the patients, and this was also confirmed by the doctors. In Poland and in Latvia, the radiation oncologist got an internship, and this is a very good practice which can be extended to other specialists in other countries which left Ukraine. As for the capacity, during my conversation with doctors, I was told that almost all the centers have a possibility to treat both the local patients and the refugees. General capacity is from 80 to 210 patients per day. The majority of centers work 5 days a week. Some of them work 6 days a week. The majority of centers cope with the patients in flow and at the moment do not have limits to treat new patients. The transfer procedure has been established, so even those who have lost their documents about their previous treatment, they have a possibility to continue treatment, and there is a procedure how to transfer them. Naturally, the biggest load at the moment on the centers is in Western Ukraine, which accumulated the majority of the refugees, and the load per device increased by 50%. And naturally, in the areas close to hostilities, the number of patients more than halved. As for the needs, in almost all the cases, I was told that there is a need in disposable fixing masks, mainly for head and neck, and each of the hospitals named more or less the same figures, from 50 to 100 masks for head and neck per hospital. And I think we should address this issue and organize the process of meeting these needs as much as we can. Some hospitals pointed out to the need to receive 2-point masks for pelvis minor and mamas in the number of about 40 to 50. And there are some minor needs which you may see in our presentation. Several hospitals said that they need to recharge their cobalt devices, but I think that there's a certain procedure with the approved suppliers. And if we speak in more detail with them, we should understand how this procedure will work and how much we can assist them. So this is generally it. If you have any questions, you're kindly welcome to ask. Thank you for your attention.
Right, sorry, I'm so sorry. I've had to join my phone. My internet's been messing around. I just wanted to thank you. That was an absolutely brilliant update. It's really humbling hearing what Ukraine has actually managed to do. In the fact, it's unbelievable what everybody must have gone through, and to keep those centres running is amazing. So thank you for that. People, if you can put questions in the chat function as well, because we're slightly behind time now. We want to get a few more people in, but thank you. And on that website, that data is going to be updated all the time, and that is absolutely brilliant and really help us, and kind of well done, and all our best wishes to everybody there, and thank you for that. So I just want to bring in now, we discussed last time about transferring data, particularly radiotherapy details if somebody is between countries, and Mike is here from Darien now, who's come up with a universal consent form that would be useful. It's on the website. So Mike, if I can just hand over to you, and you can tell us about that.
So this is to deal with free movement of data and the processing of that data. So what we will have on screen, hopefully soon, thank you, second slide, is a two-page form, very simple. Ukrainian language is the lead language, and then an English version. And this is where a patient that's been treated in Ukraine presents themselves to a host hospital, take as an example Poland, stating that they had received treatment. What this two-page form includes is the patient giving their consent to the Polish hospital to write to the Ukrainian hospital saying, please release my records. Ukrainian hospital, I give you authorization to release under Ukrainian requirements, data privacy and patient confidentiality. And then for the patient to allow the host hospital to continue treatment or to nominate another third-party hospital to continue treatment. That is the synopsis of the two-pager. I can take questions offline. Darien has my contact details. If we go to the next slide, there are two stages involved, patient consent and data transfer. I've spoken about the patient consent. If we can go on to the next slide. This is the data transfer. So this is where the manufacturers would come in. Polish hospital would say, patient has presented, we have all the consents in place, you have the data on your device in Ukraine, we need you to download that information. Here's a data processing agreement, and here is a remote access agreement which the manufacturer would have the hospital sign. Now, the last two documents, the data processing agreement, is something that hospitals will have as a standard form. The remote access agreement is something which manufacturers will have as a standard form as well. But the most important thing for the purposes of the patient is the first document, the 2-page data consent. Hopefully that's not too quick on what is. It shouldn't be a difficult operation, because the 2-pager has all of the relevant consents to meet Ukrainian requirements and also EU data privacy requirements. And this has been written by a Ukrainian lawyer. It's been checked by a data privacy lawyer in Poland. And meeting the Polish requirements will mean that it meets the other 28 member states of the European Union as well, if a Ukrainian patient presents themselves to any EU country, and obviously UK as well.
Michael, that's fantastic, fantastic. Anybody want to make a quick point about that? I think that's going to be really useful, and we need to, I was thinking, Richard, we need to think about how we can get that information out to people, because that's fantastic. And thank you for all that work from all the lawyers in Poland and yourself and data protection and everything. Good. Okay, and that is on the website as well.
Correct.
And I'm quite sure you'll be always available if we have any concerns.
Please do. The important thing is the exercise has to be done per patient. So it's not to take a whole bunch of information of records and send it over to a hospital. We need to observe the Ukrainian data privacy requirements and obviously the EU as well.
And Richard's just asked, could this be used for transfer of non-radiotherapy data, like imaging data, like on
yes.
Great.
Yes,
so
it's a general consent form, and the second part, the manufacturer and the hospital, this is where standard documentation, the manufacturers would be able to issue that information. But for radiotherapy, for that information that's stored on a device, this would work.
Brilliant. That could solve a lot of problems. Great. Okay,
but
lovely.
I'm available afterwards.
Yes, thank you so much. That's lovely. Great. Okay. Again, I'm conscious of time, but do please use the chat box and do contact us afterwards. So then we've got actually from some details about some Ukrainian support in America. Natalia is going to speak now from Stanford.
So hello, everybody. Thank you for inviting me to speak. My name is Natalia Kovalchuk, and I'm a medical physicist. I'm currently work at Stanford, but I'm originally from Lviv Oblast, Ukraine, from Drohobych. And I'm collaborating with some of the Ukrainians in the US. Roman Kovalchuk, he's a radiation oncology resident at Mayo Clinic. Viktor Yakovenko, he's a Ukrainian born medical physicist at UT Southwestern Texas. And Nelia Melnichuk, she is the surgeon at Harvard, Massachusetts, so all over US. Next slide, please. So we've written up the article in Advances in Radiation Oncology and Situation in Oncology and Radiation Oncology in Ukraine. We interviewed Andriy Beznosenko. He is our Chief Medical Officer of Ukraine's National Cancer Institute in Kyiv. He's also president of Ukrainian Society of Medical Oncology. It was a great interview, and we keep in touch with him, and he shares the needs. So from that interview, from the data he provided and from the data from the Ministry of Health of Ukraine, you can go to next slide, please. We determined as of April 2nd, so that was a little bit older data, but I feel it still stands. So 89% of national cancer centers in Ukraine were providing chemotherapy and surgical cancer treatments, and 36% of those providing surgical services were providing it in urgent setting only. So surgery is not really full on opened yet. 71% of national cancer centers were providing radiotherapy services. So that number probably decreased now with the war activities in Donbass area. State Nuclear Regulatory Inspectorate of Ukraine has banned the export, import, transportation, and use of radiopharmaceuticals during the war. Therefore, nuclear medicine departments across the country do not conduct diagnostic or treatment procedures. And even before the war, there was a problem with access to the PET in Ukraine, there were 3 PET machines in Kyiv, but now there's only 1, and now they cannot even use it to diagnose and potentially check the progress of the disease. So that's a really big issue. And Nelia Melnichuk currently is petitioning different vendors. So we are writing letters to various vendors to donate the PET machines, and also we need cyclotrons to provide pharmaceuticals for them. Supply chains got disrupted, as were shown by 2 physicists here at the presentation, Ruslan Zelinsky, Alexander Zakharchenko. And the cancer centers need supply. So we reached out to all the cancer centers. Not many responded. We got around 5 responses. So most of the needs were chemotherapy drugs, and also, as Ruslan and Alexander mentioned, immobilization devices, masks, and so forth. So we have the list of those in English. And we were looking for donors, and actually I already connected with Diana Hryshchenko, I think, in the chat. So Hryshchuk, sorry. So we are looking for donors, and it would be great if I can help out. The vendor support is lacking. So here you could see the Halcyon installed at National Cancer Institute in Kyiv. It's been sitting there for months now. And it cannot be operational. The Darien, who's the huge vendor, pulled out all their engineering support. So we were petitioning Darien, since Darien is right here, this next to Stanford campus. We know their leadership to restart Halcyon and enable at least that one cancer center that does not have radiotherapy at all at the moment, because their old LINAC is broken and there's nobody to fix it. There's also huge staffing issues. From what Andriy Beznosenko is telling us, that he's performing the duties of a secretary and other responsibilities, nursing, because the staff evacuated from Kyiv area and they still don't feel safe to come back. Next slide, please. So what are we doing? We are petitioning U.S. hospitals to send medical supplies. So for example, Stanford, we sent 165,000 worth of medical supplies. Mayo, they created a match donation. As well, Stanford students together with Nova Ukraine. It's a big foundation here in the Silicon Valley, California. We shipped 3.5 million worth of emergency care medical supplies to Ukraine. We're petitioning Darien to support Ukraine with resources and fundraising. So Darien, by the way, donated 1 million euro matched fundraiser to Ukraine. We petitioned Astro, APM, ASCO for dedicated sessions for Ukraine during the annual meetings. So we are working on organizing those sessions. We developed the telemedicine app for Ukrainian patients and doctors. So there are multiple telemedicine platforms, and we created our own here at Stanford. And I know that Umana, the American Association of Doctors, they collaborate with Viveo platform. That's something that's really needed for Ukrainians. It's just the general medicine consults and so forth. We are organizing and fundraising for a training program in US, Canada for displaced female doctors of various specialties. That's something that Andriy Beznosenko really asked us to do. So we already reaching out and interviewing those displaced female doctors, and we are finding spots for them here to be trained in US. And that's something we really need help with. We are fundraising. That's a big project that we're working on. Developing remote training resources for Ukrainian radoncs and med physicists. So what I learned from Ukrainian radoncs, that halcyons are very popular right now. So they're around, I think 7 or so halcyons in Ukraine, but 3 of them are not operational yet. So they were either just delivered or installed and sitting there without being functional. So we are developing training resources for physicists and for physicians and translating them into Ukrainian. And also connecting pediatric onc patients with St. Jude triaging system for evacuation. So this is my last slide, and I'd like to thank you, Slava Ukraini. And this is the photograph of the Stanford students after the vigil for Ukraine. Thank you so much.
Great, that's lovely. Look, thank you very much, Nat. I see in the chat box now, obviously there's some different views here, and I know Darien and Elector are on and things, and obviously do link up with them afterwards if there's any confusion about engineers being there. I'm sure we can get these out. And I must say, I know everybody's working hard, and it's great now you can connect perhaps with Ruslan and Alexander, and actually all that work can come together. Great. Okay, so do please get in touch with the manufacturers as well who are on. That's great. Okay, I think we need to move on now. And this is just wanted to go over some methodology now that have between Romania and Moldova about how they've been working on some patient transfer, which we thought was very interesting. So Horia, I think you were going to present something on this. Thank you.
Hi, yes, thanks so much for having me on. Can you guys see my screen here?
Yes, that's lovely. Thank you.
Okay, wonderful. We just put together a few slides about a young collaboration between Moldova, Romania, and US and other international partners. So I'm Horia Volpe. I'm one of the radiation oncologists here in Honolulu. I'm originally from Romania. I trained in Toronto in Canada, and I've been working in the US since 2018. And Stefania Magidson is on as well. She's the founder of Blue Heron Foundation, which has been operating out of California to help Romanian and Moldovan orphaned and abandoned youth with support and mentoring programs back home. So they have a long history of working in Eastern Europe and a lot of contacts. And Dr. Irina Tosino, she's a professor of radiology at Yale, and she's recently been on the ground for a needs assessment on behalf of Blue Heron. So in some of our meetings with the contacts from Blue Heron in Moldova, we found that there was a need related to cancer patients, Ukrainian cancer refugees. So as of my conversation earlier today with Dr. Ruslan Baltaga from the Institute of Oncology in Chisinau, they've registered about 195 Ukrainian refugees with cancer. Now, most of these actually want to stay to be treated locally, if possible. They have an option to be transferred to Western Europe, to the EU, but they want to stay close to Ukraine's borders. There's a language barrier as well, maybe other barriers. So out of 76 patients that accepted a potential transfer, only 16 so far have actually managed to go through with that transfer to get treatment abroad. So not a straightforward process. And in Moldova, they have about 32 other patients that are registered that could receive local treatment if they have the funds to pay for them. So that brings us to the next point, which is that Moldova can only cover mostly emergency care for refugees and some other services, but not continuation of care or very complex treatments. So for example, radiotherapy is not covered. Other cancer therapies like surgery, chemotherapy, a lot of them are out of pocket. They're looking at maybe changing that for a few cancer types in the near future, but they have, like we mentioned in other presentations today, a lot of capacity issues. So their chemo supply has been disrupted. They only have 2 Linacs and the Cobalt, they need about 10. They have a lack of medical imaging at their Institute of Oncology. And even right now, less than half of cancer patients who should be getting radiation in Moldova get it. There's long wait times even for the Moldovan citizens themselves, and the Institute is working closely with partners at the MOH, WHO, IEA to try to increase capacity. I heard today that there were even some protests from Ukrainian refugees, that some of the medical staff are getting called with a daily increase in cancer patients from Ukraine asking for help. So, between us, with Stefania, myself, Dr. Tosino, we found that, maybe transferring these patients to Romania where cancer care is covered for refugees would be an acceptable option for a lot of these patients in Moldova. So we're looking to set up multidisciplinary tumor boards and triage system to make sure these appropriate patients for transfer, cover some of their investigation costs in Moldova, their paperwork, transfer to Romania, lodging, treatment, and then return to Moldova, or perhaps even a rotational migration, depending on what their needs are. So here's our early collaboration. So the Blue Heron Foundation is able to help with some financial and logistical support for investigations, transportation, lodging, medical file translations, needs assessments on the ground. Dr. Tosino just came back from Moldova and Romania. And myself, I will be heading to Chisinau next week. And we'll spend some time in Moldova and Romania as well. We even think we can support some of the financial treatments for patients who want to stay in Moldova and there are drugs or other therapies they need, so that not everybody needs to be transferred to neighboring Romania. In Moldova, the partners will have local consultations with these patients, arrange for the investigations, diagnosis, discuss transfer with them when that's appropriate, share the files for the tumor boards, organize accompaniers, interpreters, paperwork, and we do have support of their Ministry of Health as well. In Romania, the cancer treatments are covered and reimbursed by the state, which is great. We have at least 3 large cancer clinic networks who are ready to accept these patients. I put their logos at the beginning, and I just saw in the chat that one of our colleagues from Prof in Romania also mentions that they are accepting patients, and I know that there are a number of Ukrainian patients already being treated in Romania. There are some existing partnerships between the different MOHs for transfer of medical patients. We have an IT platform called Medikai that has been active in over 30 clinics in Romania for patient file transfer that is HIPAA and GDPR compliant, and we also have support from our MOH. And internationally, we have a group of Romanian-speaking cancer experts through a Heal 21 platform organized by a colleague called Doru Powell from Cornell, and we have Ukrainian doctors in the US ready to help us with translations when needed. So to summarize, we seem to have all the pieces in place to take immediate action for these patients. And actually, as we speak, the first patient files are being translated. It's a patient with a pancreatic neuroendocrine tumor. But logistically, it is quite complex, and we're still learning how to work with each other. And we hope that this first patient can be transferred, first pilot patient can be transferred successfully. And I just want to thank a lot of the Moldovan partners, Romanian partners. There's many more people here who have come to help us that I couldn't have space to include. So thank you very much. I can take questions maybe on the chat or suggestions or even advice. So thanks for listening.
That's fantastic. Thank you so much. Some great work there done in those countries. That's fantastic, and a good model for others as well. Thank you. Lovely. Okay, I'm conscious of time, so please use the chat for discussions, and also can get in touch with people if they want to leave their emails afterwards. That's fantastic. So moving on, I just wanted to spend a few minutes, if there are any from our colleagues from Poland, Hungary. I know somebody has just left and said he couldn't stay longer, or Slovakia. Is there any updates from people that we want to share from there? I'm slightly compromised with my reaction as I'm on 2 screens here. Shout if there's anybody who needed to. No, okay. Well, look, if anybody thinks of anything or any contacts, please put them in the chat box from the other countries as well. I've certainly heard from our contacts who were on last time from Poland. A lot of their cancer centres are doing a lot of the reconstruction after the war injuries as well. So again, perhaps not being having to do the acute stuff first on the oncology side. And obviously they're going through a lot themselves as well. Okay, I just wanted to bring in now, I understand we've got some people from the IEA on. I was wondering if you could, Yaroslav, you were going to update us on the work the IEA have been doing. Particularly, it'd be interesting to hear about the radio protection issues. Obviously, there's an issue there with the transportation of isotopes. I know Ruslan was telling us their iridium can't function now because of that. And there's a lot of cobalt in the country. So, Yaroslav, from the IEA's point of view, do speak.
Yes, thank you for this opportunity. Доброго дня до всіх моїх українських колег. From IE perspective, of course, a few updates. Cobalt sources, it's a big security issue, and even the transferring any isotopes, I think it's, as I understand from the speaking to Ukrainian colleagues, it's a national issue. Right now, it's forbidden to transfer anything over the Ukraine. I'm not a big expert in security, but from what we know, that is the situation. IAEA finished just now, like a few days ago, updating the DIRAC database. So DIRAC, I don't know if everyone knows, it's a unique resource in the World Directory of Radiotherapy Equipment. And that was the scheduled exercise, actually, with annual exercise with Ukraine for updates. Larissa Stagnik, who's currently in Kharkov and was doing this by hearing the shouting and shouting all these last days, she completed all updates, which data was collected at the beginning of the year, and now it's uploaded to DIRAC. So we have the pretty much accurate information at the beginning of the year. So we know about all sources, cobalt sources, which were operational in February, let's say, their activities and the status before before invasion. So that is that exercise is completed. Now we are approaching annual again schedule for dosimetry audit. Again, the schedule for Ukraine was supposed to happen in June. We go ahead. Logistic is completely broken. We have to establish the new logistic, but we're working very closely with Ruslan to transfer all dosimeters to Ukrainian hospitals. If everything will go according to the plan, all dosimeters will be with Ruslan on Friday. So we could start audit this year, and maybe we even will be able to do that a little bit early, maybe in May. So we are open for any adjustments in time, and if hospitals will be ready to do it early in May, we can handle it. So that is update from, I know, very quick update from our side.
Great, that's brilliant. And please stay in touch, because it's really important that we sort of link all this up. And just to say also, your direct database is so fantastic, and I know Ruslan's got that up on our site where we link to the Ukrainian Medical Physics Association. That data is from you, so that's great that we've got that core data. That's brilliant, and it'd be fantastic if you can do a dosimetry audit.
I can see lots of information from our database in your presentation, even on your site. I think our data. So yes, this resource is very active and very, I would say, dynamic, and we really try to do everything what is possible and impossible in this situation to keep information up to date.
Yeah, I think the direct website is so important. That's fantastic. Great. As I say, do keep in touch. That's good. And people do use the chat box. Can I just now bring in Astro? We're very lucky to have members of Astro here today. Is it Liz who's going to talk for Astro? Who's going to speak?
Yes, thank you, Pat. And I will be very brief, keeping an eye on the clock here. First, I just want to thank you again for the opportunity for Astro to be part of this. We have several Astro staff members here, including, I'd just like to acknowledge our CEO, Laura Teveno, who is on the call as well today. And we are fully committed to this effort. Just a few kind of quick, brief points about what we've done since the last meeting. We created an information hub on our Astro website and are using this to share statement of support, links, and different resources to materials for patients and clinicians in Ukraine, such as the GCR radiotherapy data request. And one point I want to make is we also shared information on the volunteer opportunity from the Clinician Volunteer Corps. And we do know that several radiation oncologists have volunteered to help field calls and to be part of this effort. A second kind of major effort, our open access journal, Advances in Radiation Oncology, has been soliciting and publishing articles specifically focused on the crisis. Dr. Kovalchuk just a few minutes ago mentioned an interview that was published, and she also herself wrote a very moving call for help. Two other interesting pieces. We have an article from some radiation oncologists in Poland and Italy, where they're really describing their experiences on the ground, treating patients who are refugees from Ukraine, and also offering advice to other practitioners. And a team in Turkey did an interesting piece about the psychosocial impact of the war on pediatric patients and their families from Ukraine. So the RADOT community kind of coming together to help share advice for others. We're continuing to solicit articles there, and we'll be promoting them also. And then the third piece, just very briefly, is we are working to kind of be a conduit to gather and also share information using our member newsletter, being active on all our different social media platforms to try and promote the information and the great work that's being done. And I've been taking lots of notes today for additional things that we'll be sharing over the next few days and weeks about what's going on here. So I'm going to drop my email in the chat. If anyone has questions, I can get to our CEO or the rest of our staff or anything else. So that's my 20-second update. Thank you again for the opportunity to chat.
Oh, no, thank you. We're so glad ASTRO could participate. It's amazing, and thank you for all your coming. So we'll make sure we've got your information linked to our website and everything. I think we've got to just get all this information, share, and as much support as we can. So, and if we can think of any other ways to collaborate, let us know. That's a fantastic from Facts the Chat. I was just going to do a quick update from ASTRO. Unfortunately, they're busy with the annual meeting at the moment. They couldn't attend. But just to say the work they're doing, they're actually got together a group that are going to contribute to the survey, and that should be ready to send out with questions on in Eastern Europe and Ukraine about tumour sites and what capacity and that thing. And I understand they're going to be sending that out in May or June, but they send apologies for can't be here. And obviously just saying we're still linking in and communicating almost daily with EcoAstro, again, if there's any synergies. And I think that what's important there is for the disease, like Richard mentioned, the lymphoma group, so they can access all the radiotherapy they might need to that, or patient groups. So I think if we can get all that we need from the radiotherapy community, and then others can access that when we need as well, which is great. Okay, well, we've come to the end of our time. Look, I want to thank everybody. That was absolutely amazing. I think we've moved an awful lot as a task force, and we want to be able to basically to serve really in Ukraine and Eastern European. So, do shout if we're not doing the right things or not doing enough of the right things. And we just want to be able to be a conduit to get as much done as we can. We'll work closely with Richard, and please keep in touch. You can see we've got Twitter accounts and everything. Please just keep distributing the information. Just to say, so thank you. And these are all the documents on board. And we're hopefully to be having another meeting in another few weeks. But thank you all. And those in Ukraine, please look after yourselves. Okay, thank you very much, everybody. Goodbye.